Good morning. I heard you guys when I pulled you on the communities tab and I asked about what specialties you wanted to see. Right behind oral surgery, you guys wanted to see ortho. So this week we're in the ortho clinic. So ortho clinic for us means we're obviously not doing any ortho procedures, but we are assisting the orthodontic residents who are in, I believe, a 3-year program. And we have a list of procedures that we have to do with them. But also we have to complete 4 consultations where we classify the patient accurately, analyze their teeth, and then we also do kind of like an analysis of, oh, it's so bright, the kind of facial profile and skeletal profile, etc. that they have. So we have to do 4 of those, and I'll show you guys what they look like. And then tomorrow we're also doing additional assignments called records analyses. It's a very busy day. Well, I just missed the train. Okay. Hopefully my train comes soon. Since I'm waiting, I thought I would show you guys what we have to do. So the 4 formatives are the 4 consults that we have to do. Then we have to make sure we tie in a wire with O-ties, assist with a bonding or insertion, and then assist with initial records, and then 2 records analysis. So it's already Wednesday of the week that we're on rotation, but Monday was kind of a slow day because we had their lectures in the morning, and then in the afternoon we helped the residents see patients. We had classes yesterday. Today it's our first full day. That's what the ortho clinic looks like. Say hi, Zaya. Finished helping with an O-tie change. It's one of the requirements on our little list from this morning, so I got that done. Hopefully able to do a consult, but to be determined because the patient is a little bit late, so hopefully they show up. I'm actually excited because you get to do a little bit more like work and analysis for the formative, which is where you look at the patient, you analyze their bite, and you get to apply a lot of the knowledge that we learned in our ortho class. And that's part of a consultation that the resident does with them. So like they'll do their consultation, and then while they're filling out the paperwork, we get to do our analysis. So hopefully that patient shows up, but stay tuned. Alrighty, just finished for lunch. Ended up not really doing much after I helped put on those O-ties, mostly just observing people working. I did get to help one of the residents who's doing an NIH-funded study, which was really cool. It wasn't too ortho related, but it was interesting. They're studying gingival attachment levels and crevicular fluid levels and how they're affected by recall intervals. So that was cool. Now just had his lunch, grabbing a quick bite because I only have like 30 minutes, and then heading right back, hopefully to get a few consults this afternoon. Okay, just finished my first consult formative. Wasn't perfect, but it was okay. It is 4 p.m. We just finished the day. I actually got out on time today, and I got to finish my second consult formative, which was great because it kind of quieted out in the second half of the day, and I was worried that there wasn't going to be another one for me to do, but there was, so that's good. So thankful to my resident that I was working with for being so patient, because I was definitely getting things wrong, and she was kind of helping guide me and giving me some pointers. Good morning. It is day 2 in ortho. Actually, it's day 4 because it's Thursday. Oh, it's too dark. There we go. Day 2 of me vlogging it for you guys. This morning we are going to be assisting in the clinic with patients, and then this afternoon we're working on our records analysis, which is more like a paperwork assignment, but we're actually going to get to use real patient cases that the residents have done in the past to do a full case analysis, occlusion analysis, and then also come up with a treatment plan for the patients. And then we will submit that to get graded, and it'll kind of put the skills that we learned this week to use. We get to work on it as a group, which is nice, so it's not like a solo assignment. But I'm running late this morning, so I'm gonna go and catch the train. Get on what my checklist looks like. Just one more formative left. So we're working on our case analysis now. We're going to be breaking down how the patient's intraoral exam, extraoral exam, soft tissue, and bite looks. We're gonna get photos, x-rays, and also a cephalometric, what is it called? A cephalometric x-ray? Is that what it's called? Anyway, lateral ceph. That's what it's called. And we're gonna analyze what kind of treatment they could possibly need. So this is our patient case. The first one that we're working on, it's a 9-year-old patient with a severe impaction of his upper incisors, which are right here. This is his pano, and this is his ceph. And it's such an interesting case to see where his teeth are and how impacted they are. Like this, the rotation. Yeah. It's a baby tooth, so maintain midlines. Possible for nectomy.
On the pan is the lower right for baby tooth.
This?
Yeah.
No, it's a big one.
We always check orthodontic evaluation, I thought.
Obviously, orthodontic evaluation, phase 1.
Radiology.
Yeah, radiology for CBCT.
Fine. I said to also rotate this. I said to also rotate.
Okay, I like that better. Wait, what about for mandibular? I can't even see.
Yeah, because it's planning the entire thing. No, I think it's current treatment plan.
Did they say canine extrusion with no rotation and open bite?
Isn't open bite?
It's not severe, but it's open. It's hard to see, but
the-
doesn't
they
are side
they
edge
are.
maybe?
Definitely the 2s and the 3s
They aren't.
are not touching.
So it's edge to edge.
Here,
And then open?
not touching here.
Yeah, just some of the anteriors are
He's pretty straight.
I would say straight.
I can't tell if it's like basically jutted out or that's like natural position.
No, he's definitely slouching. He's like this.
Yeah.
He's like me. We both stepped.
Average nose.
Yeah. His lips are average.
Cute.
Is it cute?
In his labial angle?
Lightly cute. It looks 90. I can't tell if it's confident. His ventalis looks like it's...
No, I think it's not.
His
I think
ventalis looks like
he's
it's straining.
Yeah.
Doesn't it? Like,
Yeah.
I feel like his chin...
Look at his chin.
Yeah.
You can see kind of like that.
I see something in the chin, but I can't tell if he's...
But it's like, look at the shape of it.
Yeah,
I'm gonna say
more
it's not
stretched.
confident.
Yeah, I don't think it's. And that makes sense because he's so edge to edge, so his lower jaw is more forward than it should be. So he has to strain to close his mouth. So I think it's incompetent. Facial symmetry.
About 50 for both.
I think for the lowers, it's a little bit more. Like 60.
I say 50-50.
But then
For
you
the
can
top,
see
for the lowers too.
Yeah, just because you lose it with the other two.
A little bit more than 50. Look
60.
how much of the tooth...
I think it also
only
depends on
one,
his
yeah.
lip.
For shits and giggles.
Okay. Dental status. Let's talk about this.
No.
On top he has his canines. He has his primary canines
He has a primary tooth still up there. What is
and
that?
he has an over-retained primary tooth.
Yeah.
So, okay, so let's do one thing at a time. So he's got his
One.
ones, twos. He's still got his baby canines, so C's,
How can you tell? Oh, because they're small.
because they're tiny. And then he's got one, so he's got the upper right
The left.
4. No, upper right 4. Upper left is also there.
And 5 on the upper left.
And 5 on the upper left, but no 5 on the upper right. You still
He's a
have
baby,
Yeah.
baby,
Baby molar.
Baby molar.
But
yeah,
unless
so you have
that's
the D, I mean E.
unless that's the premolar.
Could be. So that could be. The
But-
premolar's coming in, but it's like
So-
this,
so
so it's
both
not
of them are-
resorbing. So you're
both of
probably
them
going to
are-
need extraction.
So ectopic eruption, we would say.
So would I
Yeah,
put
the
5
top
and
eruption
E?
of upper right 5.
Would I circle 5 and E on that
Yeah.
side?
No, because 5 is not fully erupted.
But you still see it in the
Just as present.
I'm gonna circle both and just write ectopic eruption of 5.
He's got his 6s.
And 7 I'm not seeing.
No, they're not in yet. So unerupted, unerupted.
Going deep enough.
What? Oh, the photo?
Wait, no, they're erupted in the bottom.
They're erupted on the bottom. They're not erupted on the top. Because you can see they're still
Oh.
below the soft tissue.
Yeah.
Also, whoever did this pan did not put the right settings because it's not supposed to
Smiley
be this wide.
face. Well, let me see. What do we have for the bottom?
Okay, so for the bottoms, we've got all the incisors, we've got the canines. Actually,
Do the
all
canines?
his lower teeth are permanent teeth.
Yeah.
So,
Period. Wait, how? The lowers come first, that's right. Or some, for a lot of them.
depends on which teeth. He has his lower 7s. Okay, so we've got any restorations? There's a restoration on the
Restorations?
occlusal. Yeah.
Oh
Restoration on
my-
the occlusal.
Yeah, I don't see anything else.
Number 19 occlusal.
19 occlusal, 30 occlusal, 30
And number
occlusal.
2.
Great.
Oh, I
This
can
is a
see that one.
sealant.
So maybe they're all
How do we put
sealants.
sealant? No, you wouldn't see a
No.
sealant on a radiograph.
We could just write sealant.
Oh, just write S?
Are you sure?
I would write the word
You
sealant.
wouldn't see
I
sealant
have-
on radiographs.
I have
You
patients
don't
that are marked, so you wouldn't like it has to be deep
For it to be showing up in a radiograph. No, this is a restoration.
Yeah.
This is a restoration. Also. That's what I'm saying. Like, you wouldn't see. It's so small and it's so, like,
The teeth are wet.
very wetty. Okay, alright, done with that. Okay, maxillary labial frenum.
Where is it?
It's right here.
so then I think it's
So
Oh, it's fine.
High
High.
attachment.
Isn't high good?
Yeah. Mandibular lingual frenum. I mean, it's like, it's fine. I think I'm inclined to say it's good.
But he has
Okay.
Prestos. I don't know.
Yeah,
If that means
okay.
anything.
That's fine. Alright, let's talk about his molar classification.
Who the fuck's who? Oh.
So,
it looks a little
so look, this is the edge of the cusp. This is the tip of the
What
cusp.
the note says.
And it's slightly behind.
It's gonna be a class. I'm reading more class 3, but I'm curious.
Well, it would be right is class 1, left is class 3. This is a permanent canine, but the upper is a primary canine. So you can't do a canine classification on primary canine.
I just got home a little while ago. It has been a long day and an even longer week. We finished off the day by presenting cases that my group mates and I were working on. We actually ended up presenting to one of the attending faculty and we got a lot of really great feedback. Obviously, a lot of it was not like perfect. We didn't get, you know, every single classification right, but I think that it was a good learning experience. You know, we weren't like being graded on what things we got right and wrong. We were more so just kind of having a discussion on why we thought something was one way versus another way. In the cases where we didn't get like the correct classification for something, you know, the attending would kind of tell us based on this factor and based on this imaging, I would say that this is so-and-so. And I thought that was really helpful because when we had to do similar assignments during our preclinical ortho course, we didn't get as much feedback because we had to like submit an assignment and it was graded and then we were just like told what things were right and wrong. That was actually the end of our ortho week because on Friday mornings we have lectures, so we're excused excused from clinic, and then Friday afternoons are actually optional for ortho clinic, and got some errands to run tomorrow afternoon, so I won't be going to clinic, and luckily I got all of my requirements done. Thank you so much for watching to the end, and if you want to see another rotation that you're interested in, let me know. I'll try to make a vlog of it as soon as we have that rotation. Also, if you're interested in some other rotations that we have, I will link them right at the end of this video. Thanks for watching, and I'll see you in the next one. Bye.
Very smooth.